Perfect. Okay. All right. Thank you for joining us, ladies and gentlemen. I'm Dr. Nilo, and just to give you a quick little information here, if you have any questions, just put them in the chat room. After Doug's introduction, he will manage the chats accordingly, and then we'll go from there. And we're going to blow your minds with what's going on. So thank you all for joining us. Go ahead, Doug.
Thank you. Once again, thanks everybody for taking time this evening to join us. We're introducing SiOS, which is the Smile and One system. It's promising to revolutionize full arch implant dentistry. This is our official unveiling. You're the first in the world to hear about this technologically advanced patent pending system that will revolutionize and transform full arch all on X dentistry. Oop, went one slide too far. Let me back up there.
You're not sharing your screen, Doug.
Yeah. What's that?
You're not sharing your screen.
It says you are screen sharing.
No, I don't see it.
Okay, hang on, Ray. We have a technical problem. It says you are sharing.
I see it.
Does
You
anybody
do?
see my screen?
Uh-huh.
Yes.
Smile and One SiOS system journey.
Yeah.
Okay, others are seeing it. So me,
Okay.
Johnny, do you see it?
Wait, I'm not seeing it. Let me see if I got to go to.
Johnny, you see it? I can't hear you. You're muted, Johnny.
I see it.
Okay. All right. The Smile and One system, our journey. 6 years of intensive development between Dr. Neil Hernandez and Johnny Orphanitis. The journey of research and development culminated in a groundbreaking system that sets a new standard for full arch implant procedures, which you're going to be wowed when you see it. We have over 50 patients who participated in our clinical validation in the development of the SiOS system, resulting in consistent and remarkable outcomes. Next slide. Come on, there you go. What is SiOS? SiOS was founded to address the confounding shortcomings of full arch all-on-X implant dentistry. The SiOS team spent years identifying the 25 challenges in performing full arch cases and how these challenges affect the desired results that clinicians are working very diligently to achieve. Using an unguided approach and the best tools we have, it is nearly impossible to achieve precision results, even for the best and most experienced clinicians. The problem, in summary, is that there is too great a margin of error, which cannot be overcome using the existing methodologies. We have a special announcement, as this is our global unveiling. We've been working for the past year with a major corporation who we are going to collaborate with, and we are going to introduce Stephen McPherson with the Ivoclar Corporation. Steve, take it for a minute.
Hi there. Hi, everybody. Yeah, as you well know, Ivoclar has always looked at nice innovation products and services and such like that. And so in this whole scenario of things, we saw this system and we are working towards, or we are collaborating with SiOS to bring this to market at some point in time. And so, and in the whole scheme of things, Ivoclar typically looks for new products or services based, are they better, faster, easier? And with the SiOS system, I think all three of those get matched. And so it's a great, we're very excited to be doing this. And I think it's going to be exciting for you guys as well.
Thanks, Stephen. Appreciate that. So let me do a brief introduction of the team. If you're a speed reader, you can read all this. I'm not going to. Our co-founder, CEO and co-founder and chief clinician is Dr. Neil Hernandez, who did the introduction, the pre-introduction. He's a highly, highly accomplished clinician, over 30 years of experience in advanced dentistry and implantology, covering both surgical and restorative. He's award-winning, he's board certified, he has placed tens of thousands of implants in his career, performed well over 1,000 conversions. He's a graduate of the Dawson Academy and MISH, and many, many postgraduate courses on advanced dentistry. Needless to say, he's the top of his game, highly respected by his peers. Also a partner in SiOS is Dr. Robert Miller, who's also very highly accomplished and also an advanced dentist with over 40 years of experience. His awards include the diplomat recipient of the Masters and Fellowship with the International Congress of Oral Implantologists. He's got quite a pedigree. He's a lecturer. He's a chairman of the Department of Implantology. He's a visiting professor. He's on the board of oral implantology of ABOI as an examiner. Quite a pedigree, and we're very proud and pleased to have his participation in our company, as he brings a lot to the table in helping us bring this product to market and through its clinical testings. Johnny is one of the finest lab technicians you'll ever meet. He's a third generation. He grew up in the lab knee high to his parents and has been doing this ever since he could spell the word lab technician. Johnny is a graduate from the Massachusetts Dental Society. He's over 50 certifications and training specializations. He has mastery of many different brand name systems. He's authored numerous papers and publications. He's worked with all implants since the early 90s. He's been a consultant with Sensible Technologies. He was tasked to bring the first digital system, partial system to market. He also worked in bringing exocad to the US market. He's taught at Tufts. He's an advisory board member to many publications. He's lectured for over a decade with Gerald Kugel, Dean of Dentistry, UMMC. Needless to say, Johnny also has a remarkable pedigree, and he's been a remarkable force to reckon with in helping us bring this technology to market because of his expertise. He's helped make this become a reality. I'm a serial entrepreneur, been doing this for 45 years, done many technology companies, startups, did a couple successful exits. Basically, I'm the person behind the scenes who tries to bring it all together. It's hard to keep pace with Johnny and Nilo, but I'm here to try to keep them on track. With that, I think we skipped the slide again. My spacebar is very fidgety. Yep, that's it. With that, we will talk about the SiOS system briefly, and then we'll turn it over to Dr. Hernandez. This is not a training, it's an introduction. It's a high-level introduction. There's a lot more detail than we can cover in this presentation. So we're just trying to get you to understand the concept, its features, and how transformative it's going to be for full arch dentistry. We'll offer in-depth training seminars. The first one will be held at the Chicago LMT show, the midwinter show in Chicago in February. And for those looking to do a thorough deep dive and understanding of the SiOS system, that's the first place you can get it. And with that, I'm going to turn it over to Dr. Hernandez, who will talk about the SiOS system and its full functionality.
Great. Let me know if you can see my screen there. Hold on. All right. You all see my screen? Perfect. All right. As you know, I'm Dr. Nilo, for those of you that know me, and those that don't. I'm looking forward to meeting you all in person. As Doug explained to you, SiOS is revolutionary. We've been working on it for a long time. And I believe that any of you that are involved in full arch workflows or even segmented workflows are going to find it quite enlightening. It's definitely a paradigm shift. And with that, I'd like to thank you all really for attending tonight's webinar. I know we've been planning this for a long time. There's quite a number of people that had registered. I haven't seen the population on the attendees, but I'm hoping that they're all here. This presentation will create a new thinking process compared to anything and everything that you've been doing before. So it's unlike anything else in the marketplace. This is truly a paradigm shift in how we will approach dental implant cases and workflows. Over the course of tonight, you will listen and probably come to agree with many of the problems and challenges affecting every single full arch case that you have done in one way or another. SiOS changes all of those problems, and for the better. This is the time to engage and solve all of the problems you're having with every workflow available today. At SiOS, we've been lucky and blessed to be partnered and aligned ourselves with some of the world's leading companies and clinicians to bring you the next generation in precision, simplicity, and innovation. Between the alignment with cutting-edge development, leading educational platforms, and world-leading companies such as Ivoclar, SiOS is changing how the world will treat implant cases and more. And this group, being the first one in the US to hear it firsthand, is a first of its kind with much more to come. So let me begin by saying we really are starting a new time in dentistry, and certainly in implant dentistry, and SiOS is going to lead the way. So the reality of it is that we all share a secret, and it's a very dirty secret at that. Every workflow presents any number of problems and challenges. Our team at SiOS has identified 25 of these, as you will see later. But SiOS has set out as a primary goal to fix all of them and improve the workflow with simplicity, precision, and accuracy. As the full arches have become commonplace across this country and abroad, more patients are finding that achieving their expectations was impossible or even very difficult at best. SiOS presents itself to you and the everyday practitioners, first of all, with simplicity, and more importantly, with precision and accuracy, unmatched in the industry today. So joining the SiOS revolution is really what this is about. We believe strongly that preparing for what's coming is the new future in dentistry, and SiOS is bringing you that. So the foundation of this predictability is based on what SiOS is all about. When we look at the current systems in the marketplace, every single one of them we found are erroneous. Everyone was wrong. They started with an implant position, and they determined the case and designed the case based on the implant position. So what we've done is taken a look and, like myself, has trained in most every system out there. Every single system currently relied on a primary, immediate, or existing denture, implant positions, and case design thereof. What is the problem? Once the case was designed with those implants in mind, the moment we got into the reality of the procedure, the surgery, the uncertainty crept in. What do I mean by it? Well, it was the uncertain that denture, that immediate denture, or the existing denture the patient was wearing, once we went into surgery and established alveoplasty and alveolectomies, we lost the landmarks. See, the problem here stems from the beginning. And by approaching it the way that every company and every competitor has, we strongly feel that that was completely wrong. Why? The same way we approach any other engineering feat, we design the end product and work back from there. So at SiOS, we've established that the only way to eliminate uncertainty, eliminate the stresses that come with the current case flows and the unpredictable outcomes was by designing a comprehensive approach. And that means that by using a complete digital workflow from the very beginning, perfect records leads to perfect design, and a perfect design leads to a perfect procedure. And only that perfect workflow leads to what we're talking about. So what am I talking is it all stems from the predictability. Why? Every single system loses the predictability of the occlusal table and the midline the moment the surgery starts. What we have done at SiOS is compared every other system in the marketplace, every one of the traditional approaches, and looked at them for face value. And what we looked at and came up to agree was that if we could establish the proper dimensions and the proper occlusion from the get-go, stabilize it with reference markers that are patented, we call them matchmakers, and Johnny will get into that further, we were able to establish that complete reference, stable from the beginning, that didn't change throughout the entire procedure, eliminating all of the problems that every single case has. And for those of you that currently do full arches and have done full arches, once I show you the 25, you're going to identify some, if not all of them. Now, I've had those 25 happen time and time again, not on every case, thank goodness, but on many cases, any number of them. So what we have come up with is that whether you're a freehand doctor or a guided doctor, the SiOS advantage still takes precedence. Why? We designed the case with you in mind. If you're a guided practitioner, the entire SiOS workflow works for you. And if you're a freehand practitioner, it does also. All we have to do is prepare the records with the certified lab, identify the source and what kind of workflow you want to incorporate, and SiOS does the rest. It's all based on achieving the perfect reality for the perfect patient satisfaction. So the future of implant dentistry is, if we continue doing the same things that we're doing now and that I've been doing for years until SiOS, expecting to achieve a different result, well, we all know what that definition is. What SiOS represents is a total leap forward in how we do things, moving forward with unprecedented precision, predictability, efficiency, with perfect occlusion and perfect aesthetics every single time. The future is now, and this is more than just for surgery. So I speak to and approach all kinds of dentists on a regular basis. Some are doing full arches. Some are afraid to do full arches because of the uncertainty. SiOS blends all these practitioners. How? Whether you're doing a segment or just a couple of implants in strategic zones or a full arch, the advantages of SiOS goes beyond surgery. We are prepared to train our doctors to do more than place implants. We can do a full mouth of prosthetics with no surgery. And that's more to be realized in additional courses. We'll get into some of that later. But what we have changed is we realized all the problems that existed and how we addressed each and every one, and how SiOS eliminates all of the problems. Just imagine and realize for a moment that if your case was completed by the laboratory, 85% of the case was shipped to you finished without the implant holes a day or two before your surgery or before your procedure. Imagine if that case was so precisely manufactured that by the time you did your procedure, whether it was surgical or non, you eliminated all the guesswork, you eliminated the uncertainty with stabilizing an immediate denture with transitional tubes and opening holes and all the imperfections that comes with opening these abstract holes and filling it and injecting it with acrylic and having all the shrinkage that comes with that. In addition to that, if I said to you that SiOS eliminates your denture conversions totally, eliminates all of your trying appointments, eliminates the need for verification jigs, all of this is done up front. You can predictably finish your patient day one and only follow them post-surgically. However, people ask me, today I had 3 phone calls. They asked me about photogrammetry. Well, if you've already bought it, so be it. Use it. No problem. It's a wonderful machine. But at SiOS, we've determined that to do this workflow, you don't need to have photogrammetry. And we can get into more in that in the in-person live seminars. So we want to introduce to you the company. The company is Smile-in-One, and it's registered. We have multiple patents. The system is called SiOS. This is the system that changes everything, whether you're doing a single segment, a single unit, or an entire mouth, or full upper, full lower arches. The predictability is consistent. The aesthetics is unmatched. And every single time you have perfect occlusion, perfect midline, and a perfect prosthesis. Now, you may be asking yourself, what kind of prosthesis? Well, at SiOS, we can do any number of prostheses, whether it's a simple provisional PMMA, or you want to do it with titanium, or you want zirconia, or you want some triloretrinia, you want some polymer. SiOS accomplishes all of it. And why do I say this? So back in 2023, we presented at the Academy of Osseointegration. We were lucky enough to unanimously win the Best Clinical Innovation Award. And at that time, this process was already proven. We had done a number of cases. And since then, we've done a number of additional cases. All the while, we continue to evolve and improve it. But let's go back for a minute. And why did we do this? Why now? There's plenty of cases. I'm not going to mention names. There's plenty of companies. This was born out of a need. Why? And people ask me that all the time. As busy as I am, why do I delve and involve so much time and effort? Because there was a need. And every single case that I did, whether it was on a man or a woman, an upper or lower, especially the lowers, they involved a denture. Whether it was an existing one, whether it was an immediate, but they were all ill-fitting. What happened was, that was fine for a denture. That's fine for a snap-in, a mini implant case. That's fine for those. It's not fine for the level of comprehensiveness that our patients are seeking when they come to us for these all-on-X cases, which, by the way, we like to call it all-on-S. So if you're frustrated with your all-on-X workflow, join us for the all-on-S revolution. Now, if we're a new practitioner or even an older practitioner that's never really done full arches, and you happen to be getting into this, and I speak to plenty, you may do one or two or a handful of cases, and for whatever reason, they all get done the same way. Why? These are flawed principles. They're taking impressions in the analog world. They're sending the analog impressions and records to the lab. The lab has to hopefully digitize these records. So it's still all based on a denture approach, that the moment you start your procedure, you lose all landmarks and that denture no longer fits the right way. And after you do all your reduction in bone and preparing the jaws and placing your implants, what you see in the mouth, as I have, is your original landmarks are no longer there. See, now you're in the guess world. You're guessing. All right, I'll place the denture, I'll reline it, I'll stick the tubes in there. And those of you that are listening to me now are probably nodding and saying, yeah, that's what's done. It's unfortunate that that's what's done, and that's all wrong. However, up to this point, that was the best the industry had until now. So we've addressed those challenges by solving the problem. So we've eliminated the immediate denture. We've eliminated the first level denture. Why? Because most of those, they weaken at the point of the most distal implant. And where does it fracture? On that distal saddle, right behind the most distal implant on one or the other side, and sometimes both. What that does is it brings in new problems, and those implants can fail. We lose bone. There's any number of situations that occur because of the failure of that converted prosthesis. We've eliminated that, so we're not using that. We're going straight to a finished prosthesis that is stronger. The holes are precisely milled chairside, so there's no added acrylic. There's no shrinkage and polymerization problems with the odd-shaped holes. So that unpredictability and all those challenges, a thing of the past. So we've reproduced the occlusion from the get-go. During our records, and when we're certifying our SiOS dentist, we're going to teach the proper workflow. Like in anything else in life, whether you're programming your computer or you're planning one of these cases, the more perfect your input of data is, the more perfect your final result is. So the keys to your success is to become reproducible and consistently predictable. So the existing methods with every single workflow out there is erroneous and unpredictable at best. Too many parts, too many pieces, too much guesswork, and a lot of religious prayers. That's no way to do this. So, as I mentioned earlier, the biggest shortcomings in the current systems is that most, if not all, start with a denture. They have a chairside conversion process that is full of multiple flaws. And then all the resistance from there are based on shortcomings. And we lead to cases that are aesthetically unpleasant. The patients are unsatisfied. They paid a lot of money. We have fracture potentials that may or may not lead to implant failures and having to redo cases. No one likes doing them. So SiOS has become the solution moving forward. If what you're looking for in your practice or your lab, because we deal with a lot of labs, is predictability and efficiency, SiOS is the answer. Now, why do I say it? It's proven nearly 60 cases, 50 some cases to be exact. We finally achieved a reproducible and predictable outcome every single time, whether we were doing a single arch, a dual arch, a segment, or a quadrant. It didn't matter. It always worked out perfect. And we never lost the occlusal position that we established from the get-go. So whether you're a believer in CR, CO, or chop chop, it didn't matter. What bite the patient presented, if it was comfortable, we were able to stabilize it at that position and reproduce and deliver a prosthesis at that position. Every single time, there was no question. So for those, you can take a picture with your phone. I'll wait for a moment. But these are really the 25 challenges, and I wanted to call them challenges for a prettier word. Really, these are 25 problems, where half of them are related to case design, surgery, and the procedure itself. And the remaining half is what happens afterwards. So what happens afterwards becomes sometimes, and many times, our biggest headaches. So once we're done with the procedure, the patient is quasi-numb, quasi-sedated. They leave. We got them out of our hair. All of you are probably nodding and smiling. When they start calling and returning is when we start seeing the reality of what happened. And this is where the cases are fractured loose, the tubes come loose, the patient is asking why they have so few teeth in the back, why the case looks crooked. These are the challenges that SiOS overcomes. It's a competitive advantage unlike anything else in the marketplace. Every other system, as I've mentioned, is limited. The entire case is limited by implant position. SiOS is the first in the world to design the case where the implant position is irrelevant to the case. We don't care. We design the case based on occlusion, midline and aesthetics, give the person the ability to communicate with the lab and determine where the implants will be placed later. And we do finish the case live, meaning we're the only company right now in the world that can finish the case, the last 15%, since the lab is doing 85% ahead of time. We do it live chairside with whatever material you choose. If you're using a PMMA, it might be 20 minutes. You're using something with titanium or polymer, it might be 30, 35 minutes. But in essence, we finish the case live at the chair the day of the procedure. We're the only ones that can do this. So I'm going to introduce to you now my partner, one of the SiOS co-founders, and the guy that I met in Chicago, and we sat around for a few hours, and battled back and forth with the problems that I was encountering, the problems he was finding with all his clients. And we laughed about it and we said, this is a journey that we want to take on. This is many years ago, nearly 6+ years ago. And here we are on the verge of unveiling our system next month live in Chicago. But you are the first to hear about it. Johnny, my brother from another mother, my partner in crime here with SiOS, take over.
All right. Well, thank you very much. I
Share your
wanted to
screen, right?
thank, I am, yeah.
Yeah.
I wanted to thank everyone here because you're sharing your precious time with us, and we know how important time is. And I just want to thank you all for putting some, sitting down and listening to something new. We're going to go through this process. The one thing I want you to try to focus in on is basically how do we take a process that we've done digitally, and then once all the parts are completed, now we have to analog put them in the mouth. We have to kind of angle to the left and to the right, bring something forward and back, worry about where the implants are placed. So our system actually resolves a lot of the issues that we have. So in the beginning section, basically the pre-surgical data uh, is pretty much the same of every other system, but there is a little bit of a difference when we go into manufacturing. So the number one visit that we have is data collection. So we want to make sure you do a comprehensive exam. That's always important. Number two, photos, 3D face scan. It doesn't have to be photos and 3D face scan, but as we see technology moving quite quickly, we're seeing that 3D face scanners are all over and they're being more and more integrated into the system. And it's going to be very helpful, especially with some of the new data that, for example, exocad is releasing where they have live video. So your patient can see what their new smile is going to look like with live video, which is really exciting. You always want buy-in with your patient. We would need a CBCT scan if we are doing guided surgery. If you want to do freehand, that's not a problem either. But it's always good to have the data. And then, of course, your iOS data. If you do want to send in impressions and you're that impression dentist, there's no problem because once they come in, we scan them, but we suggest using iOS data. And basically send them to your certified SiOS laboratory. So once the data is captured, this is actually a very close friend of mine, Tommy. This was his condition. So what we do is we take the 3D face scan and we match up his occlusion or his arches. We then do some planning. When it comes to the implant placement, this happened to be a guided surgery. And then we go ahead and start designing the smile. So in this situation, as we see, this is what you would get back if you did a case with your certified laboratory. They would give you an aesthetic diagnostic uh, uh, visual aid that you'd be able to use, like a smile design, a web view, or the live smile that exocad has. And basically, you would get approval with the patient. Of course, you would have to approve the case also and make sure everything looks good. And then we go into manufacturing. And in this situation, we basically add some material to the bottom of the prostheses because it's not going to be milled. So we accommodate. So, for example, if Dr. Hernandez Nilo tells me, "Hey, Johnny, I'm going to remove 3 millimeters of bone," I'm going to fluff up the denture at least another 3 to make it 6. And I'll explain the process to you and you'll be able to see it more clearly. But once this is done and completed, now we have our diagnostic and aesthetic approvals. They're all complete. The patient's happy, the doctor's happy. Now is where we actually begin SiOS. And this is where it gets really exciting. So basically, we have a raw puck that we start with. We have our SiOS milling process. The puck gets milled, as Dr. Hernandez said, 85% of it is milled. And then we QC it and package it and send it off to you when it's ready to go. So basically, here's the process. The raw puck goes into the SiOS laboratory mill. It's designed, and the design processes gets milled to 85%. So as you can see here, the photographs on the left, you can see that bulbous area on the bottom picture on the left. That's the extra fluff we have. On the top is the occlusion is perfect. And one thing, again, that you want to remember is because we're moving from digital and we stay in digital, occlusion is perfected because on the back end, we're not eyeballing the position. So every other system gets eyeballed. And what we want to make sure of is that occlusion, position, aesthetics, and function work all together. So once the milling process is complete, we remove the pucks and QC them. The case gets shipped, and obviously it gets delivered, hopefully. But the case gets delivered. And so what do you do as a dentist? What's the process? Well, you have a chairside mill that's specifically made for SiOS, and it is basically a surgical mill. And with this surgical mill, you take what we've sent you, the laboratory, that would be me, and the certified laboratories. And as you can see, there's no MUA seats or any kind of holes milled. So you place that into your mill, and basically you wait for your day of surgery. Hopefully the day of surgery is the next day. Or if you're doing multiple surgeries, you put them in a queue and set them up. So once that happens, now we come to the day of surgery. And why is that important? Well, during the day of surgery, there's only a couple of things that you have to do, which are very important. So one of them is to make sure that you place your matchmaker transfer guide into position. This guide could be made digitally, and it can be placed in a guided situation. So in this particular case that we're showing, it looks like a bite splint. There are 3 matchmakers on there. You can see what the matchmakers look like. That's the printed version. We have our titanium versions. And so if you wanted to do it freehand, you can place them in the area where you believe they need to go, as long as they're out of the surgical location. So you place this on, you screw them in, or you affix them to the bone. And then basically what you do is you cut off the sprues. So as you can see, it's actually a really simple process. Once that's done, this is, again, prior to you doing your full-blown surgery. Your second clinical step is basically after you cut off the sprues, you can see the matchmakers are in the arch. You would then scan. And what that means is you scan the matchmakers and the existing condition of how the patient came in. Once that's done, we send the data to the certified laboratory. That data gets sent, and you as a clinician, you begin your surgery. So we have no changes in style, guided or freehand. Your tissue, you go ahead and cut the tissue, you cut the bone if necessary, you place your implants, you put in your multi-unit abutments, and you suture, or you suture and place in your multi-unit abutments. So basically, you go ahead and complete your surgery. In the meantime, as you're working on this situation, the laboratory received this data, which is this data, as you can see on the left, and we match it to the original data, and that gives us our new rematch or our reference point. And that's what's going to bring in the rest of the data to assure everybody and assure the clinician that we have precision when it comes to finalizing position. So once you're done, and you're totally complete with your surgery, you would then scan the matchmakers, and these may be a little hard. You can see the MUAs, but you would add the scan bodies on the MUAs and include the matchmakers. So now you would take a new scan. And you might be asking, hey, everybody likes to show uppers, right? That's because uppers are easy. There's tons of landmarks. No one ever shows the lower because once you remove 6 millimeters of bone, 4 millimeters of bone, 3 millimeters of bone, now you have no landmarks. And so what we've done is we wanted to use the most difficult situation. And now we can actually reference all of these because of our matchmakers, our patented technology of our matchmakers. So you would go ahead and scan the full arch with the matchmakers in place and move forward. Once that data is done, this is really what's great about it. And I learned this through Nilo. You send the data to the laboratory so they can finalize the matching. They know where the implant positions are, and they begin to calculate the NC file, which is your milling file. But the most important part is you are actually done. You don't have to keep the patient lying down because you're doing your conversion. None of that. You sit your patient up, you begin your ice pack protocol, and you, if you want, you can go and see another patient or do what you need to do in the office while the file gets transferred. So now the laboratory calculated all of the data. Remember, the arch without the holes and the full design is in the mill. The data and NC file gets sent directly to the mill, to the chairside mill. And all you do is press the play button, the start button. About 20 minutes later, 20 to 25 minutes later, it's complete. No more conversions, perfected aesthetics, perfected position, perfected occlusion, and we're harnessing full digital precision. So there's no hand in between from day one when you sent the data till it's completed when you're ready to place into the patient's mouth. So at this point, once it's completed, now we have our screw channels in place. As you can see on the left, the MUA seats are in place and they're milled to perfection. So there's no oversized grinding for filling in the gaps, bonding, doing what you're doing, because it's the main contributing factor of breakage and failures. Again, so is the situation of the posteriors breaking off. Remember, what we're doing here is we're placing the patient in the position that you've set them up occlusally. So there's no grinding on the occlusion. It's actually ready to go. So you have this prosthesis in 20 minutes. The next step is to cut the sprues off, as you can see, and you give them a little polish. You smooth them out. You place the completed prosthesis into the arch and hand tighten the screws. You release the patient. And that really, in essence, is our process. And I'd love to field some questions. I know you're probably going to have a lot of questions, so we'll field those. But I think I'm done with my portion. I want to introduce a very close friend of mine. I loved it. Dr. Miller, he's going to be presenting his scenario. And thank you very much again for your time and listening to what we have to offer.
Nilo and Johnny, can you hear me now?
Yeah,
Yes.
I can hear you.
Okay, good. Do you want me to share my screen, or you want me to
Yeah,
play?
go ahead and share.
All right, let me just share.
Yeah,
to
Johnny,
here.
you can't field questions here on the webinar. I'll in my closing statements, I'll let them know how they can do that.
Sure. Awesome. Thank you.
Right. What I'm going to do is I'm going to bring to life what this really means clinically. It's nice to talk about in terms of theory. It's nice to talk about in terms of laboratory technique. I'm going to just go through some steps here, compare and contrast that to the all-on-X protocols that you're currently using, and then show you a video on actually how it works clinically during surgery. And if we look at, diagnosis, treatment planning, and we do our treatment planning with exocad. Exocad is probably one of the best software packages out there, not just because of its capability to do all kinds of cases, but we use it to match the pre-op to the peri-op to the post-op treatments in this. That's what makes this alive for us. And Johnny Orphanitis is a master exocad technician. We can fabricate stat guides. You can go you can place it freehand if you want to. You can place it with a guide. You can use a stat guide. You can use a stat guide with bone reduction. You can use a stat guide with bone reduction and guided implant placement. It doesn't matter, because once your implants are placed and your MUAs are in position, you simply scan those, match those to the fiducial markers known as matchmakers, and then send it to your milling machine. So we're going to show you placement of the planned prosthetic interface with the beacons. We'll show you flap, bone reduction, implant placement, and the multi-unit abutment delivery. Then we'll show you how to scan the MUAs and soft tissue position using the beacons, and the final milling of the intaglio surface. And Johnny did an excellent job in showing you in the laboratory what that looks like. And all we're going to do really is cement in the titanium cylinders and deliver a beautiful screw retained provisional. So all of the steps that you had previously had to lament over, and I know that after a tough surgery, after a long day of surgery, the last thing you want to do is spend an equal amount of time doing the prosthetics. And this is an important part. So this is the exocad protocol. And when we send a case to Johnny, we use his laboratory now. I'm sure that we'll be training other laboratory technicians to be doing these cases, but he will actually fabricate a whole PDF file that contains not only the design of all of the guides and pieces, bone reduction guides and stat guides for you, but also select implant sizes, implant diameters, implant lengths, and show you the position. And then he'll send that back to you to OK. So, he's not designing the case. He's doing the laboratory part, which he then sends to you and says, do you like these positions? If not, we'll change it. Just tell me what you want to change, and he'll make the modifications for you. So it's still doctor driven in this case. Now we're going to go on to watch this video. And this video is actually going to show you a little bit about how this is used clinically, from the diagnosis, treatment planning, prepping the patient for surgery, scanning the arch, scanning the soft tissue first. Then we can have the laboratory fabricate our guides, whether they're stacked or not, and they attach the matchmakers or the beacons to them. We use that guide to hold that guide into position in the proper occlusion, then drill the fiducial markers, these beacons, into place. Then we scan again so that the computer knows where those fiducial markers are in relation to the occlusal table. And as Johnny pointed out, the most of that puck is pre-milled. The only thing that is not milled is the underside, the intaglio surface. Here, the surgical guide is being placed, so we have the implants in the proper position. The bone reduction has been done. Implant osteotomies are created. Checking radiographically to make sure everything is in the proper position. Delivering your implants, torquing them to position. Once they're torqued to position, we'll place our multi-unit abutments, making sure that they're relatively parallel, torque the multi-unit abutments into place, suture the tissue, and then we scan the MUAs, making sure that we're also scanning the matchmakers. And that way, the computer now knows where those MUIs are in relation to the fiducial markers and the milled prosthesis. This is the key to SiOS. So now we're going to show you the milling process. The milling process can be a dry process in this case. This is the initial milling for the occlusion and aesthetics. And then that puck, when it's finished like this and colorized, is sent to you so you can reposition that in your milling machine. Once you've done your surgery and you've scanned your MUAs, it will pre-drill all of your columns. There's no cutting out of the denture. You simply cement in your titanium cylinders and then screw this into place with your abutment screws. And you are done. So we have perfect aesthetics, perfect midline, and the patient walks out of surgery in half the time that we normally spend. So it eliminates the analog denture conversion. That for me is going to be the hardest part. That's my least favorite part because I'm beat up after a surgery. I don't know about the rest of you, but when you do enough of these cases, last thing you want to do is sit around and play with the denture. It eliminates the verification jig. How many times do we take an analog impression or we scan and take an impression? We still need a verification jig. It eliminates the trying of a setup. We've pre-milled your setup and it's ready to go. There's nothing to try in. It eliminates the debonding of the titanium cylinders because whenever you put some kind of material in there that has to bond to the current material, which may be PMMA or some other material, that very often will debond in the course of function. It happens a lot. It also dramatically reduces the potential for fracture of the cantilever part of the PMMA. And any of you who have been doing All-on-X long enough have had a fractured provisional. And where do they fracture? They fracture posterior to the most posterior implant that you have. And it right where the titanium cylinder goes through, because that's the area of most stress from the cantilever, and that's the weakest part of your denture. And you can be performing other procedures while your prosthesis is being milled, and it reduces the stress for the clinician, for the office staff, and for the patient. So I'm going to turn this back to Nilo.
Thank you, Rob. And let me make sure that you all can see my screen here. It's really that simple. And for an introduction, as we're doing tonight, and what Dr. Miller and Johnny just said to you is so true. We found a way by a lot of trial and error and a lot of cases and a lot of heartache and stress early on to eliminate the most difficult and the most burdening processes that we were encountering, which was reproducing the occlusal position, these god-awful denture conversions, and even more so for those of you that don't do it and have your laboratory technician come to the office. If the lab only has one or two of these technicians that goes out to offices and they go out for a few miles, they can't go out cross country. It became very difficult for the lab people. So what we have been able to develop and with our partners certainly is the elimination of the need to have a lab person come out to your office to do a denture conversion. And for those of you that do your own denture conversions, as I have for many years, you eliminated multiple hours of this and the dirt and the filth and acrylic filings everywhere. But Johnny showed you in a very simple format. It's really those three steps. You scan before, with the matchmakers, you do your surgery. So the surgeon is just having to be a surgeon. The surgeon is not being asked to be a lab technician anymore. They don't have to know that. They can learn it, but they don't have to. So we've taken the approach that at SiOS, not only are our lab partners going to be trained and certified, the dentist is going to be trained and certified, and the assistants are going to be trained and certified. So the system and the process is proven. Not only is it proven, we have multiple patents, we have multiple papers, 6+ years in developing, refining, and with clinical trials, and over 50 cases and nearly 60 have been completed. It's interesting when people ask me, yeah, but what if I spend the money and buy the SiOS and then something else? See, the beauty of what we've developed is SiOS is going to grow with you. Whatever new modality and implants you take on, SiOS is going to adapt. SiOS is the cornerstone for your future development. Whether you're doing implant cases in full, whether you're doing segments, whether you're only doing quadrants, it doesn't matter. And for prosthodontists that don't do surgery, or for dentists that don't do surgery, we can help them too. So you can do a whole mouth of crowns without even doing the preps beforehand. More to that to come in Chicago. So you may be asking yourself, what happens now? The interesting part of what we're bringing to you today is really it's to let you know what's available. So when you partner up with SiOS and you incorporate SiOS into your practice, you're going to have to be certified. You're going to have to learn how to do it. You're going to have to understand about the matchmakers, which is really the official name. We call them beacons in everyday workflow. So right now, with the assistance of our partners and Ivoclar, the delivery and installation date is slated for Q3, Q4. We are right now in discussions with a very high-level training center, and we have one in Alabama, the state where I practice, and other locations are being scheduled as we speak so that we can satisfy getting people on other parts and other sides of this country. And hopefully next March in Germany, we will unveil SiOS to the world. And that's also to come. So what we're trying to tell you is that at present, between now and the end of February, we are in the process of registering our partner clinics and our partner labs. Why? You may be doing your own prosthesis and lab procedures in your office. But if you're not, you may be working with a lab that is assisting you. That lab will improve their workflow and be more efficient with SiOS. I encourage you to introduce them to SiOS and bring them or send them to Chicago. But we are in that process. If you're part of a DSO, we have incredible programs that we're developing and have aligned with DSOs to help them, whether they're bringing on only one facility or all of their facilities. So how do you get involved? For me, the simplest thing is attend Chicago. We're going to be at the LMT show. The LMT show is the lab show. Why? Because SiOS gets certified and delivered through high-level labs or labs that we help train to become high-level labs. The folks at Ivoclar are going to have their booths at both the dentist show and the lab show. And if you are visiting the Chicago lab show, or if you're planning to after listening to us, I invite you to come by our booth, which is booth number 0-9. And we have pre-orders with early adopter VIP pricing. Now, what do I mean by that? This is a ticket. If you want to scan the QR code, go ahead. This is the ticket to our live event. So those of you that are attending today and that have been here from the beginning until the end, you're going to receive a survey. Once you fill out that survey, you'll be receiving 2 CE credits from MBC. And those that show up to the live event in Chicago, the official unveiling in Chicago, which will be on Thursday the 20th from 1 to 3 p.m. And this is the ticket to enter. There's no charge. There's no fee. You'll also be receiving CE credits there as well. If you can't make Chicago, I'm inviting you 2 things. The first thing is I've created an open forum Zoom meeting tomorrow, not a webinar, a Zoom meeting. What I mean by an open forum, right now, you may have some key questions. You may be interested in getting involved. but you may have some key questions. The key questions may involve the training, involve who's going to be part of the training, the machinery involved, what's involved in the packages. You can be part of this. There's the link. It's on our website. When you visit SiOS Dental, that's our website, siosdental.com. The open forum link is on the homepage. The email for us, if you want to reach us, is info@siosdental.com. And I'm also showing you Johnny's cell number there and my cell number. Johnny and I are available to you and everyone that you want to refer to us for SiOS 24 hours a day, 7 days a week. I think he sleeps about as little as I do, and that's okay. As Johnny and I call, SiOS is our baby, and this is what we do. I invite you all to visit our website at siosdental.com. The open forum is tomorrow at 6 p.m. Central, 7 p.m. Eastern for 1 hour. And I thank you for joining us. If Doug has some chat questions there that he feels are interest that we may need to answer right now, I'm happy to go through them, either myself or Johnny. And if not, we can address them tomorrow on the Zoom. Stephen, thank you for joining us. If you want to say some parting words, I'm excited about you guys.
Just exciting. It's all good for everybody. So this is a great system. So I'm looking forward to it.
Great. Thank you, everybody. Thank you all for joining us. And visit siosdental.com. Join the Zoom tomorrow. And I'm hoping to see you in Chicago. Thanks a lot. Good night.
Good night.
Good night. Thank you, everyone.